PowerPoint up. Perfect. Okay. So, just to go ahead and do an intro, we do have Shannon here as the owner of our firm, and she's going to be joining us today with Lauren Atkins of Gainesville Physical Therapy, GWP Physical Therapy. And today we're talking about our senior starter kit, which is primarily we're focusing on falls and what causes them and how to prevent them. And Lauren is an expert in all things physical therapy and here to guide us. So let's go ahead and get started. I think, yeah, I think go ahead and Grant, when we're ready, we'll let you know how to go ahead and switch over that slide. Um, and we're ready now.
Okay, you can go ahead and change the slide. So when we think about balance, and we can go forward one more slide as well, we really are thinking about our base of support and our center of gravity. So our base of support is the part of our body that's contacting the ground, and that's what's keeping us upright. So when we're standing or when we're walking, what we're usually thinking about are our feet. And then when we think about center of gravity, that's what represents the point that keeps our body's mass evenly over our base of support. So it's evenly distributed in all directions. And so when we can go ahead to the next slide. When we're thinking about something like walking, right? Constantly, as we're moving forward, our center of gravity is shifting outside of our base of support. So those feet are then moving along with us to keep up and keep us from falling. So there's two main reasons that we fall. The first one is that we can't reach the necessary position to keep our center of gravity within that base of support, or we can't do it fast enough, right? And so that's what we think about with reaction time and things like that. So when we think about the two reasons, to simplify it a little bit more, is we don't have enough time. Our body isn't fast enough to what we call have a stepping strategy, which is, oh my gosh, the grass is uneven and I step out to the side. Or we don't have the range of motion, which can happen in the sense of my foot doesn't have the range or my hip is really stiff. And so I can't move it out to the side to give myself that wider base of support. So those are kind of our big reasons, like why do we fall? How do we fall? Basics.
And I think it was really when we were talking ahead of time from the webinar perspective, you were explaining how there are certain types of actions people will do when they don't even know that they're doing them to help prevent falls. So I thought that was really interesting and wanted to go into that a little bit. So wall hugging or a couple of the other
Yep.
ones you talked about.
Yeah, totally. So we can go forward two more slides. So we're going to look at kind of like what are the common misconceptions is what Amber and I were talking about. And when we think about balance training, and I think especially in the realm of physical therapy, we think of classic balance exercises and strengthening. So that first misconception is increasing stability, or we could say increasing strength is going to decrease our risk of falls. When we look at the research on this, it doesn't. And that doesn't mean that it's not a good idea to do it. It's just a starting place. So a few times here, we're going to use the analogy of driving a car. If I wanted to get better at driving a car, I wouldn't sit in my garage and adjust my mirrors over and over again and get the seat just right and get that lumbar support going. That's not going to help me be a better driver. I'm going to be able to see around me a little bit more. But the way we become a better driver is actually practicing the task, right? So when I'm working on quadricep strength or I'm doing glute bridges to get my, hips stabilized and my core activated, it's something that helps me get ready for walking or get ready for chasing my grandchildren in the park. But it's not specifically retraining me to be able to be more effective at that exercise. And so the same thing is true for the second misconception that Amber and I talked about, which is a lot of the stereotypical exercises that we do in physical therapy. Stand with your legs, one foot in front of the other, stand on one leg, use your whole foot. All of those are awesome cues and awesome tools. and it doesn't address the dynamic challenges of our center of gravity moving outside of our base of support. And so that's what we're going to address in some of the exercises that we go over today, is starting to look at working on the dynamic challenges, because that's really what's going to get you better at that specific activity, is practicing that task. And we can go ahead to the next slide as well. So just kind of recapping, the balance exercises are good, but that's a starter point. Strengthening is good, and that's a starter point. And then kind of what Amber and I talked about before is like, well, then what do you do if you're telling us all this stuff that doesn't help? Why am I listening to this webinar?
And
Okay,
I think
wait,
also,
can I jump in? I just have a question. All right,
Yeah.
Lauren, I hate to do this to you.
Oh, give it to me.
Okay, so we have a ton of clients that come in
Yes.
and they are living at home,
Mm-hmm.
but they do not want to use a walker. And
Absolutely.
the way that they move through the world is like very tentatively, and they hold on to things. Like they're holding on to the wall, they're holding on to the chair, the table, the da 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 da. And they say, I'm very careful, Shannon. I know my doctor said I need a walker, but I am so careful. I only touch something and then I touch something. Help me out here. How can we help this person? And should they be using a walker instead of like walking with like their hands on the wall and that sort of thing?
So Amber and I went over this. There is a term that we have for this. It's not an official medical term, but it's called furniture surfing. And that is what that person is doing. And, there's ways to be more safe with furniture surfing, which is a wall. A way I have had a lot of patients have falls in the home is their furniture surfing from the doorway to the recliner or chair, or whatever it is, something that's not bolted to the ground. They lose their balance, they grab that item, and that item ends up on top of them.
Oh.
Right. And that's something that we see and hear a lot, and it's super dangerous. So I think that the purpose of a walker and the purpose of a single point cane is to give you a stable external source outside of your base of support to widen that base, right? It's the same reason if you ran up to me, Shannon, because you were going to tackle me, I wouldn't put my feet super close together, right? I would get wide. I'm ready. Like she's coming for me. And so that's life. Life is coming for us, right? And so we are more stable the wider that base of support is. And that's why assistive devices are helpful when used appropriately. So I think one thing I was just having a conversation with a patient that had a total knee replacement that didn't want to use a walker or a cane. It's not something you're going to have to use forever. If you work hard at getting stronger, you work hard at the balance exercises, and then you transition into some of these more dynamic stabilization exercises, then you get rid of it, right? Just like an orthotic in your shoe. Hopefully, your arch gets stronger and you get rid of it. And so I think it's a way to think about, it's a blip in time that I'm using this to help me not fall so I don't hurt myself, because we could go down the rabbit hole of the risk of death with a hip fracture, right? We probably all know those stats off the top of our head, and they're astronomical and they're super scary. And so if we can prevent that by using a walker for a month, to me, that's well worth it.
Okay, thanks. I'm sorry I had to jump in there.
Yeah, it's okay. Amber's like, oh my gosh, Lauren's talking too much. We're on a timeline.
not at all. I was actually just thinking about the other part of that conversation we had, which was
Yeah.
not wanting to furniture surf, but also perhaps not wanting to have that walker or cane, and
Yeah.
how actually that walker and cane is very helpful to keep
Mm-hmm.
growing and making sure that you're building that base of support. And the alternative of not moving actually is not helpful to continue to move forward.
Absolutely. And to go back to the analogy of a car, right? The best way to get safer on the road isn't also to say, okay, well, you say adjusting my mirrors on my seat isn't the way to do it. So I'm just going to hop on the interstate and go 80 miles per hour, right? The
Dive right
way
in.
the way to be successful is slow and steady. And so starting with those small, safe changes and then building upon that. So where we're saying like, okay, we're going to start with the single leg balance that you're standing still and I'm holding on to you. And then we're going to work on transitioning that into walking faster. Okay, like now, at our clinic, we have a little path with woods around the back. We'll take patients, have a belt on them to assist us, and we'll walk through there. Okay, walk faster. Okay, now in the grass, bend down and pick something up because that's what you're going to do with your grandkids at the playground. Like it's the same. I have a patient that had a fall and broke her wrist and her hip, and she needs to be able to quickly get up and off the ground because her grandchild is going to at some point run away from her because that's what they do. They're cute and they want to run and they want you to chase them. And, so being practical about it, I think is a way that we can create safe, small changes that patients can feel successful and they're not worried they're going to fall with what we're giving them for homework per se. We can go ahead and change the next slide too. And this goes into kind of some of what you were saying too, Amber, of like starting where the patient is, because everyone's different. And we're going to go through these 5 exercises and they're not appropriate for everybody. And so people can kind of deem what feels like a good starting place for them. But the challenge is that slow and steady growth, and then we continue to make it more difficult. That's how you make progress. And that's how you don't suffer those serious consequences of something like actually having a fall and having an injury.
Yeah, and I think it's really important starting from where every person is because when they see you, it's something different every time. And the same that we see at home. Every home is different, the risks are different, and where they're needing the help too. So
Right.
that's beautiful.
Absolutely. Absolutely.
Okay.
So, and we can go ahead to the next slide as well, because that speaks a little bit more to what we're saying of like, what are these examples? And so the first one that we have is called effective walking. And so that's really your biggest bang for your buck exercise because it's what we've been talking about this whole time of actually doing it, right? So you're getting out there and you're actually walking. We can go ahead and play the video and then we can kind of talk through it a little bit. It does have cues in it as we're going through the exercise.
I never knew I had to learn how to walk.
So it has sound that's with it, Grant, but do you want me to talk us through it? Because I can do that as well.
Yeah, go ahead and talk through it, I suppose,
Okay.
because I guess that sound is not coming through.
That's okay. No problem.
Thanks.
So what we're working on here is we're walking over ground and we're working on our arm swing. So something that we lose a lot as we age is arm swing. And that reciprocal motion of this really helps us to keep our balance, helps us to keep our core engaged. The other thing that we're thinking about here is keeping our eyes at the horizon. So we're thinking about, I'm looking out and in front of me. That's also going to help us with our balance. That visual cue is going to help us with proprioception, which what that means is knowing where I am in space without looking down at the ground. A lot of times as we age, we start to look down at the ground and then we move closer to the ground, and that actually increases our risks of a fall. It feels safer to us in our brain, but if you can see how Jen is keeping her head over her hips, that's a lot safer for us. She also is working on increasing her arm swing as she's going along. So a fun exercise to do when you're doing this effective walking is keeping my eyes on the horizon, swinging my arms, and then seeing, can I see my arms in that lower peripheral vision, right? Because that's going to help me a lot to get a little bit more of this And then is it equal on both sides? Am I swinging my right arm and my left arm equally? Am I able to kind of push the ground away on both sides? There's a lot of literature to show us that if, as I'm coming over that foot and toe, I'm going to get more glute contraction. And then Amber and I talked about this. The way to supercharge this is to do it with friends. To do 30 minutes of walking 7 days a week with friends is huge for a lot of reasons. One, we're increasing our social connections, which decreases loneliness. And there's a lot of correlation with loneliness. And we could do a whole nother talk on that, on things that that can cause. But also it's dual
motivating
tasking.
factor.
Yeah. Mm-hmm.
Getting to go with someone, you're actually going to go and do it and not think about maybe
Yeah.
not a day.
Hey,
Absolutely.
and Lauren, it was neat how you kind of were telling people like swing your arms like this, make sure you see them in their vision. Is it a good idea for people to like videotape themselves so they can check that little list that you're
Yeah.
talking about?
Yeah.
And I'm also wondering, you know, for the rest of the webinar, can we kind of give people a second to do it and like tell them?
Yeah.
Because I think that would be helpful. Like I know we did a Pilates webinar for foot strength last couple weeks ago. And I did some of the stuff that they were suggesting during the webinar. And I was like, oh my gosh, I can't lift my pinky toe and keep my big toe on the ground. So maybe and I know for me, like I haven't gone back to review it. So maybe if we just like give a little, you guys get up and walk and see, can you see your hands when that way people get a little instruction while we're doing this.
I was very slightly moving my arms while you were talking.
Right. I got up and walked and I realized that I don't see my hands
Yeah.
when I swing my arms, which is really impactful. Yeah. So I need to swing my arms more, I think.
Yes. Yes. So if everyone wants to try to stand up, if that feels safe for you. And it's interesting to play with this with and without shoes. So you can really feel your feet a lot more without shoes if that feels comfortable for you. Shoes can give us a little more support, so that may be a better option. And you're thinking about, as you're walking, keeping your head over your shoulders and then over your hips, and you're looking at the horizon. So I'm just looking out straight in front of me. And I'm swinging my arms opposite. So the leg that's forward, we're going like this, back and forth, and see if you can see, while keeping your eyes on the horizon, can you see your hands moving in that lower portion, that lower quadrant of your peripheral vision? Then the other thing to think about, besides the social aspect of going with friends, is dual tasking. So cognitively, when I am up and walking and I'm concentrating on that one thing, that's the exercise within itself of arm swing. Am I pushing the ground away? Are my abs firing as I'm swinging my arms? The second thing is, if I have to talk while I'm thinking about all of that, that's a lot harder for my brain. And so that's a great cognitive task for us as well. So that going with friends and chatting supercharges it from a lot of different directions, socially and cognitively.
I need a new walking buddy, it sounds like.
You can walk your cats, Amber.
It's been a little while, actually. I need to.
We have someone in our neighborhood that puts a harness on their cat and walks their cat.
Oh my gosh.
Yeah.
I'll be it'll be even harder for my brain when I'm talking to my cat because I've got to learn cat knees.
Yeah.
I know we have a couple. Go ahead, sorry.
No, go.
I know we have a couple other exercises though that are going to be just as interesting, I believe, as well.
Yes. So that first exercise is really looking at the task at hand and how we can optimize that. These next three are really things that are going to help us when we talk about, do I have the availability of my joints or the strength to keep that center of gravity within my base of support? So this next one that's called effective breathing, you're working on getting your rib cage over your pelvis. And Megan's going to go into a little bit of an explanation in the beginning. And I think we've got audio on it. So if we want to just go ahead and play it.
into the rib cage and the diaphragm, but it's also something that we incorporate into a lot of the other exercises that we give out here at the clinic. So you're going to start by laying flat on your back with your knees bent.
And whoever wants can try this as we go along. I'll cue it a second round
From
as
this
well.
position, you're going to think of slowly bringing your hips underneath you, just so that your back is flat in whatever surface you're laying on. You'll have one hand on your chest, the other hand on your stomach. When we breathe in, we're going to think of gently pressing our tongue to the roof of our mouth, and our lips are going to be closed. And we're creating a nice quiet inhale, so it's going to look like this. And you really want to focus on trying to get your hand on your chest and the hand on the stomach to rise at the same time. So we're making this a nice quiet inhale. We're not forcing any air into our system. One more time.
As you're breathing in, you're
When we
also thinking
exhale,
about
we're thinking of a
improving
nice
your rib cage
slow
mobility.
exhale with our mouth open, almost thinking of letting ourselves deflate into the table. So quiet inhale.
Inhale through the nose,
Long
exhale through the mouth. Nice and easy. We're not forcing it, just nice and easy.
You're going to breathe out until you start to feel your lower abdomen turn on, but we don't want to breathe out so much that we get a lot of muscle contraction. We're trying to keep this as relaxed as possible. So one more time, quiet inhale, tongue on the roof of the mouth, lips closed. Nice long exhale, letting yourself deflate into the table.
So you guys may be watching this wondering why, if I'm learning to balance, am I laying on my back breathing? And so, we could say as we get older, but I would really say as we grow up and get jobs and sit at computers and drive around all the time and everything we do is here, 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 this gets really stiff. And so it's hard to swing your arms. It's hard to reach up and get something. It's hard to have upright posture. And if we can focus on effective breathing to get that rib cage to expand and then compress, that's going to improve rotation. It's also going to improve our mechanics of getting the rib cage over the pelvis to help our abs fire to keep us stable. And so that's where this breathing portion can really help keep that center of gravity within the base of support.
Okay, I'm going to add one more thing to this, being the yoga instructor. It also helps you with interoception. So we talked about proprioception, moving through your body, moving through space. Interoception is going to start to connect you with your internal organs. So your pelvic floor, right? Lauren, we know the importance of connecting with your pelvic floor. And then like your lungs, and then even if you can feel the beating of your heart, like these things we know help with the neural pathways in your brain. So not only are you helping yourself walk, but once you learn to breathe properly and you really start connecting with your breath, all these other benefits come, like interoception and all these other great things that we're trying to focus on as we age.
Yeah, and increasing parasympathetic nervous system stimulation.
Yes.
Yeah, we could all use that.
Especially at the beginning of this webinar.
Yeah, and I think that, that's something to talk about too, right? Like decreasing cortisol, that's just like better for overall living and feeling good. So it's a great exercise for a lot of different reasons. This next one also includes some breathing in it. You may need a little bit more space on a bed or the floor for it. If you guys want to go ahead and play it,
to begin,
we can talk through it.
Face up, knees bent. And for this exercise, we will be inhaling and exhaling for 5 seconds. If you feel like this tempo of breathing is overly stressful, then adjust the time to what is appropriate for you. You should not feel like you're suffocating. To start, quietly inhale through your nose for 5 seconds. You should feel your chest and your stomach rise together. Long exhale through your mouth for 5 seconds and feel your chest and your stomach go down together. Feel your back fall into the earth. You should not be using a ton of ab tension to do this. Now, quiet inhale through your nose for 5 seconds and focus on keeping your back heavy on the ground. See if you can do this without overly bracing your abs. Next, we're going to add in some leg movements to this exercise. On the next 5-second quiet inhale, let one of your knees fall to the side while the other knee stays still. Then relaxed exhale for 5 seconds. Let the other knee follow on the same side. Focused on recreating heavy in the back feeling, even though you're turned to the side and your back is not fully flat on the ground. Quiet inhale, bring the second knee back to center while the first knee stays still. Relaxed exhale, bring the first knee back to center. When you're at the center, pause for a second, fully exhale, and reinforce that feeling of having your back pressed into the earth. Now for the other side. Inhale 5 seconds, knee falls down to the side. Exhale 5 seconds, the other knee follows.
So this exercise is addressing a couple
Inhale 5
different
seconds,
things. It's
bring the knee
addressing
back to
that
center.
rib cage mobility, it's addressing core,
Exhale,
and it's
and bring the
addressing
other knee
hip.
back to center.
And that's a big
Again,
part
when you're in the
of
center, pause to
not
refocus on
falling
feeling like your back
is,
is pressed
do
into
we
the earth.
have mobility
You're
to
going to repeat
move our
this,
lower
going back and forth
extremity
20
forward,
times, 10
back,
times
out
each
to the
side,
side to
alternating back and
increase
forth.
that base of support?
While you're doing it,
This is a
focus on
really
one
safe,
leg moving at a
easy
time.
way that you can do this at
Always
home.
inhaling and exhaling with your
That you
stomach and
guys are
chest moving
working
together.
on the core, the hip,
Whenever
the
you return to the
lumbar,
center,
all of those
focus on the
different
feeling of
areas.
having your back
The
stay
next
heavy on the ground.
exercise that we're going to go over addresses the other piece that we were talking about, which is the foot. So when we're trying to create a stepping strategy and increase that base of support, speed is important, which we'll go over in the last one, but this one starts to look at the mobility of our foot and how we can improve mobility to give us that strategy. She is going to use a tennis ball. That's the softest way to do this. You could use a lacrosse ball, you could use a golf ball, just anything round and kind of mobile that can help to conform to the shape of your foot to improve mobility. Because similar to the rib cage, the foot gets stiff as we age.
With a tennis ball or a softball, you'll begin by putting your foot in front of you and having the ball under the arch of your foot. Roll the ball forward and backwards, reaching your foot away from you and bringing your foot back underneath you, working different angles of the tissue underneath your foot. Next, bring your foot underneath you and place the ball under your heel. With your feet on the ground, without any knee pain, you'll gently bring your knee forward and bring your knee backwards, stretching your ankle, putting pressure on the heel of your foot. Just like before, you can move the ball around to explore different tissues and different areas on your heel.
So this is also helping to improve ankle mobility, because this motion that we call dorsiflexion, we need the foot to be able to move in this angle
move your
to
foot
get that
behind
heel to
you,
toe, what we were
placing the
talking about in the
ball
first
right
video.
in the front of your foot behind your toes. Now, picking your heel up and down, you'll work the tissue in between each toe, moving your heel away from the ground, moving your heel towards the ground.
And Shannon can probably speak to this too, is from the
Perform this
yoga
activity on
perspective, that
both
mobility in
sides,
the foot
doing
is
as much as
so important to be able to keep your balance, because it allows you to access all of those little muscles in your foot.
And you, you know, you don't realize, like, I'm a yoga teacher and I do yoga all week, but when I was doing these toe strength exercises, I thought for sure, I mean, I come home as well and I take my shoes off. So I try and be barefoot as much as I can. And you'll find, Lauren, if you come to our office, a bunch of us are barefoot kind of walking around, but it's because we know the benefit of like your toes spreading and using, the toe strength. And when you're walking on the front of your foot, that it's 7 times your body weight that you're putting on, right? It's like that ball of your foot.
Yeah.
It's like a lot. And I think when we're in shoes all the time and we're squishing our toes together at the front of our foot, like that toe strength kind of goes away. And like the separation between your big toe and your pinky toe, like it's definitely like my feet, I am definitely not as connected to my feet as I used to be when I was younger. And I feel like when I did the ball exercises, just kind of mapping the bottom of my feet, I was shocked to learn that some of the things that I was like interoceptively connecting with in my brain was a new feeling for me. It wasn't something, it's interesting that our feet really need a lot of attention.
They do. They do. I mean, the like saying of if you don't use it, you lose it is true. I mean, my 5-year-old, I was drawing with her and she's like, Mommy, you'd be a better drawer if you practiced. And it was like, that hurts. And she's not wrong,
They have so much insight.
Yeah. 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 But it speaks to it. Like she's right. I'm not drawing all the time anymore like I used to as a kid. And we're not walking around barefoot all the time like we used to as children. And so things change.
I think also going back to what you were saying too about how when we get to working and we're sitting at our desks and we're computers in front of us or our phones, we're doing a lot more sitting. We're not walking even when we are perhaps able to. And that's why we have a lot of people at our office who also have treadmills in front of their desk too.
Yeah, absolutely. Absolutely. And this next exercise that we're going to go through, it starts with kind of the upper end of the spectrum because she's dynamically moving and tracking something with her eyes and shifting. But we're going to give a little bit safer way to try it at home as well. She's going to use a balloon, which you guys can just keep kind of a pre-blown up balloon at the house to practice this. There's other ways to do it as well. I have some patients that are pickleballers or tennis players. And so I actually have them to work on balance and moving forward and working on backing up. They're hitting on the paddle or they're hitting on the tennis racket, their ball. So if this is too easy for you and you want to make it sports specific to pickleball or tennis or fill in the blank, you can practice with other things.
Balloon juggling. This is a great exercise to work on balance and speed. It's very important before you start to look around and make sure there's nothing you can trip over, for instance, a rug, and nothing you can bump into, like a coffee table or a couch. The safest one would be little tiny juggles, so bouncing the balloon back and forth, letting your feet move naturally, staying relaxed, using your eyes on the balloon. To make it more challenging, you can hit the balloon a little bit harder. That's going to make it more time in the air. It's also going to make you chase after it a little bit more. But once again, stay safe and be careful with your surroundings. Finally, if this one's feeling too dangerous, you can always do it seated. So sitting on an object or leaning against a wall, you can just do little taps. Once again, using your eyes, using your hands, keeping the balloon in the air.
Yeah. So that leaning against the wall, that's a lot safer way to do it. The other thing to think about is if we have transitional lenses, this can make that exercise a little bit more difficult. So if you can see up close and taking your glasses off feels safe for you, that may be a more effective way to do this exercise. Because, exploring that transition of depth can make it pretty tricky. Yeah.
It also just looks fun.
Yeah. Yeah, it is. It's super fun. And it teaches us to use the core. It teaches us to create those dynamic stepping strategies. So that the first one and the last one are what we're talking about of making the exercise more dynamic and more specific to what we're actually trying to achieve as our goal. And the 3 in the middle are working on that range of motion with a little bit of that stability component. So those are kind of those starter exercises that we discussed. And I think a great way to approach this is being consistent. If doing all 5 does not feel available, absolutely don't start with doing all 5. Start with doing 1. Start with walking into Publix, trying to look at the horizon, or walking, trying to look at where your arms are swinging. Because when we try to take on too much, there's so much research to show that that does not work and we just stop doing it. Yeah. So consistency is important. And then overall, trying to maintain that active lifestyle as much as we can. As we fear falling more, what we see over and over again is isolation. Fear of falling causes isolation. People stop going and walking their trash can out. They stop going and getting their mail. They stop saying hi to their neighbors. And that is really, really not good for us as humans. We need other humans. And so I think just staying as active and connected as possible.
And I think, Lauren, it kind of speaks to our whole life care planning model. And, if you were in the room, you'd be like, yep. But when we do these first initial meetings with clients and we talk about the best way to leave this world is to keep moving and like thriving, die.
Yeah.
So,
Yeah.
like as we continue to do these things, if we slow down before, the end, what can happen is a super slow, painful, full of suffering decline.
Yeah.
And we've all seen that where people linger and they're not dead yet, but they sure aren't living a full and happy, healthy life. But if we keep moving, if we keep the brain engaged, if we keep moving our bodies, if we keep those neural pathways open, and that includes, like, people think, oh, my exercise has nothing to do with my brain, but it absolutely does. And so, as if you're sitting in a recliner all day watching television, what does happen is that your brain, your neural pathways, you can't remember how to move your pinky anymore or your baby toe. And that does, in fact, create this deficit with regard to the neural pathways. So, I love what you're saying about like this isolation coupled with that, where you're just home because you're afraid to fall. Get your walker out, learn how to use it, and then you progress to your cane. And then, you're stable enough that you can continue to really thrive. And when you're doing that, your entire life gets better. So yeah, it's really good stuff.
Yeah. Thank you. Thank you guys for having me.
Yeah, it's great.
Can only second everything.
Okay, but Lauren, before you leave, tell us what you do and what GWP is and like what can clients do if they want to hire okay, first I have to ask you this question. With physical therapy, is it like you only need physical therapy when you break a hip or when you break an arm or you sprain your ankle? Are those the only times as we age that we should be going to engage in physical therapy?
Well, I think that is where we see a lot of people feeling like, oh, this is something that I need to do. And I think for a lot of patients, that's their first point of entry with physical therapy. And then once they learn about it, it's like, oh, I'm kind of feeling something. I had a patient like this yesterday. She felt something in her wrist. It's not really a big issue yet, but she was like, let's take a look at it. Or, we have patients that they're feeling not quite as safe going on a walk as they used to around their neighborhood. And they're thinking, okay, I probably have something going on and I should come and get this checked out. You don't have to have an injury. I think the other way that we have a lot of patients come in is they're just starting to feel some changes. It may be the same reason that you talk to your PCP and say, hey, I want to get some blood work because I'm feeling a little off. I'm feeling a little tired. Right? So the same thing when we're feeling that maybe there's something we can work on, that's a great time to come in.
Okay, and let me ask you this. Like my dad is 84. Well, he's 83. He's almost 84. And he walks like 10,000 steps a day, right?
Mm-hmm.
But I see him becoming more unsteady. And the majority of his exercise is walking, but he's doing not a whole, I mean, he's a gardener too, but he's not doing a whole lot of lateral movement and he's not doing a lot of the other strength training stuff. So I'm worried that if all he's doing is walking, isn't there a time where we probably want to start adding in some of these other things, just because as we age, we're becoming more unsteady? PT may be something that you just do as part of your, living as we age. I mean, do you think that's the case more and more, or is that really something people shy away from?
No, I think that's completely it. I think that, in the healthcare model, physical therapists are the musculoskeletal experts. So when you look at where the training is for med school, for PA, for nursing, they're not getting a lot of the the physics of how the human body is moving and how we can strengthen and optimize that and that anatomy. And so that's absolutely something that we can do where we're helping them age gracefully, or like someone with your dad, it's great that he can walk 10,000 steps, and we may need to challenge him more dynamically, where there's a therapist behind him making sure he doesn't actually fall, but let's put him on a squishy pad and throw the ball over here and throw it over here
Yes.
and get the core engaged, those kinds
Yes.
of things.
Yeah. Yeah. And I think that's a big thing with seniors, is that they think, oh, I walk a lot. But they're not doing that. That's one set, kind of process in your brain. And if what we're trying to do is keep our brains engaged, then we also have to be doing full body exercise like yoga, or, something else, Tai Chi or something like that, that's going to engage all of the different areas of your brain.
Yeah. And then again, this could be a whole nother webinar, but it's like
Yeah.
weight bearing exercise and osteoporosis and
Yeah.
osteopenia. The patient that I had recently that fell and fractured her wrist and her hip has pretty bad osteoporosis. And so then those are things, whether it's weight bearing exercise with the combination of supplements or in conjunction with your MD, looking at supplementing with different medications, but it's so important. So important.
And also some of the things our clients struggle with is incontinence. And you guys, I know, have women's health PTs, and just PTs, not necessarily women's health. Men have pelvic floors too.
Yep.
So
Yep.
just addressing some of those pelvic floor, urinary tract issues is something else that PTs can help with.
Absolutely. So incontinence is something we treat very frequently in men and women in our clinic. And we see people that, never had a baby and they're suffering from incontinence. And so they feel like, why is this happening? And it's the same thing. As we get older, muscles become weaker. Those muscles are also, it's a sling, it's fighting gravity. And so those are things that we can address in women and men. And then we see a lot of people that are post-surgical, and the surgery may have been recent or long ago. But post-prostatectomy, where people, it's like, oh, well, I always peed a little after I sneezed ever since I had my prostate removed. And then now they go for a walk, and 5 minutes in, they're leaking consistently with walking. And that can be really isolating as well. And there's absolutely something we can work on.
That's awesome. All right. Tell us about GWP. Where are you located? How do people get an appointment with you? What does your group look like?
So we are a group of therapists that specialize in a lot of different things, and we are all one-on-one patient care, meaning that you are with the therapist that evaluates you through the course of your treatment. We're not handing you off to techs or students or things like that. You're with a licensed therapist. And that really allows us to specifically address your goals, because you get to know that therapist and they know what you want to improve upon and what you want to work on. We're located in Gainesville off of 39th Avenue in Magnolia Park. And you could contact us by emailing info@gwpfit.com. I know Grant put some of our contact stuff in there as well. So you can call us at our phone number any way that you want. Send a pigeon with a little note. We'll call you.
Lauren, okay, I'm just going to ask you this one more thing.
Yeah.
All right. So you probably have a client story of someone coming in and having trouble, like moving from the chair to a standing up position, or being unable to raise their hand over their head. tell us just one client story about really changing someone's life with regard to how mobile they started with and where they ended up.
Yeah, so I definitely have lots and lots of stories. I will say one that was super impactful for me was a patient that came into us and her husband was dying of cancer. And so she was trying to stay strong because she wanted to keep him at home and she wanted to help take care of him. And so we got her through that process and staying strong. Her husband did end up passing away, and she started to feel isolated, living in the same house by herself. Her walking group was like the big thing that kept her going. And she started to have some back pain and some weakness in her legs. And so she stopped walking. And then she really wasn't connecting with anyone. And because she had already come to us before, she came back to us and we worked on those things. We worked on balance. We worked on getting her legs stronger. And then we walked in the parking lot together. We walked on increased cadence. And so she got back to that community, which was really her only social community, was these ladies that all walked together in her neighborhood. So that was really important for her.
Love that. That's the stuff, you know?
Yeah. Yeah.
And probably that social engagement, but also just like the conversation, like engaging your brain to come up with an
Yeah.
answer that it really does help, even with things like, you know, aphasia. Like if you have a neurocognitive disease, you know, it can really help with like, you just have to talk to people
You do.
and
You do.
practice. It's just like what you said, you've got to practice.
Yeah.
So
Practice and that walking with a group and talking to them and hey,
yeah,
look at this, hey, look at that, direction changes, all of that, that's super helpful. It sounds so simple and
yeah,
it's so effective.
I love it. Walking with the group. I'm putting it on the list.
All right.
All right. Okay. Well, thank you so much, Lauren, you know, for
Thank you.
coming and like taking time away from your practice and sharing the videos. And this content is going to be available. So you guys, when you get the email that has the webinar and you know somebody out there who could really benefit from these 5 exercises, please pass it along. You know, we want people to learn. We want you guys to stay healthy out there. And, you know, if you're thinking about physical therapy, just on a regular basis, this is what I recommend to people. I'm like, just go in there like every couple weeks. You get a session with someone and they give you some training and they look at what your progress is. And what you'll notice is that you just start to live better because you're not so concerned about falling down or like your thumb hurts or whatever. It's like every 2 weeks you get to go and complain to Lauren about, you
Love
know,
it.
for me, it's my golfer's elbow or I got this thumb thing going right now. So like, if, you know, it's something to think about, really trying to take care of yourself and just proactively help yourself to avoid some of those crises events that can happen when we just aren't strong enough to stand up from a chair.
No, absolutely. 100%.
Okay. All right, guys. Thank you so much. And we'll see you, I don't know, in 2 weeks. Does anybody remember what the topic is next time? Grant's like, I don't know.
I
None
don't
of us
think
know.
we have one yet.
It will be posted, however. So keep a lookout and we will see you in a couple weeks. Thank
All
you,
right, thanks,
Lauren.
guys.
Thanks, Lauren.
Bye.